Good morning. I am Dr. Mathew from the Department of Oral Pathology and Oral Microbiology. Today, I will be presenting on the alveolar bone. The contents of my presentation would include introduction, composition, structure and functions, the histology and applied aspects of alveolar bone. To begin with, what you can see in this slide is the maxillary alveolar bone. Now, this here is because the oral mucosa has been reflected, and thereby you can clearly see the sockets where the roots of the tooth are embedded. And as you can see here, these are the anterior teeth, while here is where the posterior teeth would be there. That is from the premolars to the molars. This is the oral mucosa, and this comprises of the sockets. Now, moving on to the composition of alveolar bone. Alveolar bone comprises of the inorganic component and the organic component. The inorganic component is made up of hydroxyapatite crystal, which forms the basic bulk of the bone, or the dry weight of the alveolar bone, which is around 65 to 67%. The organic portion is again predominantly by the collagen fibers, followed by the non-collagenous component. The collagenous component is type 1 collagen, which forms around 28%. While we have other ground substances such as chondroitin sulfate, keratin sulfate, and hyaluronic acid. Now, the point which you must here notice is that the inorganic portion is comprised of the hydroxyapatite crystals, which are made up of various minerals such as calcium, phosphate, bicarbonates, citrates, magnesium, potassium, and sodium. Now, histologically, how can we study bone? Histologically, as I said, again, we will try to visualize both the inorganic and the organic component. Now, in order to study the inorganic component, what we do is something known as ground sections. Now, ground sections are where you take a piece of bone, place it on a polishing stone, and keep moving along the surfaces. Thereby, we grind it or ground the piece of bone to the desired area or the area where we need to see under the microscope. The decalcified section is prepared by using mild acids. Thereby, the calcium or the inorganic component is removed, and we can visualize the organic component. The mild acids which are used are the mild or less concentrated forms of acids such as nitric acid. This will take a lot of time, maybe around 1 to 2 days, and it has to be carefully seen that the bone does not completely get decalcified to a section where we cannot, it will even destroy the soft tissues. Yeah. Now, moving on to the structure and functions. Now, the bone is basically comprised of, we have the alveolar bone proper, the cortical plates, and the trabecular bone. Alveolar bone proper. What is alveolar bone proper? As you can see here, the tooth is embedded within the socket. And this socket over here is lined by a bone, which is called as the alveolar bone. And histologically, we will see it, what else it's called as. And then here we have the cortical plates. We have the lingual and the palatal plates. Lingual is for the mandible, where we have the tongue, that is the inner surface of the alveolar bone, which is where we see the tongue, so we call it as the lingual. And palatal in case of the maxilla, and case of the labial in case of the anterior teeth, and buccal in case of the posterior teeth. Then we have the trabecular bone, which forms inside. It's like sandwich between the cortical plates. These comprise of the marrow spaces where we can see blood and the blood vessels and nerves. So you can call, so this picture, as you can see here, this is the mandible. Here we have done a cross section of the symphysis region, and where we can see the cortical plates, the body of the mandible. This picture has been taken from 10 Kates. This is a high-power picture just to appreciate the trabecular pattern of the bone. Next, we move on to the histology of the bone. The histology of the bone would have been covered in your general histology in your anatomy subject. Here, I will be talking to you about the basics histology structural components of the bone. Now, we have here the osteoblasts. Now, the osteoblasts are the cells which are responsible for the secretion of bone. Bone is indeed first secreted as soft and unmineralized bone, which is called as osteoid, which later calcifies, and thereby the osteoblasts comprise and get condensed into cells called as osteocytes. Now, moving on, we have the first structure, that is the Haversian canal. It, as you can see here, it comprises of the blood vessels. And then we have osteoblasts, which deposit the bone or osteoid, which undergo calcification. Initially, it is in circular or around the Haversian canal. Thereby, it is called as concentric lamellae. It is called as concentric lamellae. So I repeat, we have the Haversian canal, which comprise of blood vessels. Then we have the presence of osteoblasts, which secrete osteoid, that is the unmineralized bone. And then we have the bone which is deposited around the Haversian canal, which is called as the concentric lamellae. Then these structures wherein you see a Haversian canal and the concentric lamellae are called as osteons. Now, as you can see here, I have shown 1, 2, 3, 4 osteons. So what we see is that there are some bone which is formed in between these osteons, and they are called as interstitial lamellae. And the whole thing is covered by a bone which forms the circumference of the bone, or also called as the circumferential lamellae. Now, this is a picture trying to show the schematic or 3D schematic of the bone. First, we can see here the presence of the bone and the compact bone, comprising of the marrow cavity and the compact bone. The center of the bone is also called as spongy bone. We have the blood vessels, which form the Haversian canal, the Haversian lamellae or the concentric lamellae, the lamellae or the bone which is in between these osteons, which are called as the interstitial lamellae. Then we have the lamellae that forms all around these osteons, collection of osteons, which are called the circumferential lamellae. So what we see is the Haversian canal is in the center, as you can see here. Each Haversian canal communicates with another Haversian canal by something known as the Volkmann canal. There's something known as the Volkmann canal. So you can say they're transverse sections of the Haversian canals. So now, as I said, histology, you can study by ground section. So you can see a ground section of a bone. This on the right-hand side is a schematic presentation of the bone, which is on the left-hand side. This is how we see actually under the ground section, where we see no staining. We can see the Haversian canal. We can see the concentric, we can appreciate the concentric lamellae, the interstitial lamellae, which are there in between the osteons. And these spaces are where the osteocytes are present. Because this is a ground section, osteocytes are usually lost. This is a polarized view where we can appreciate the architecture or the deposition of the bone, where we can see it as a lamellar pattern, concentric lamellae, which you can clearly see here around the Haversian canal. Next, we have the decalcified section, where we can see that there is no concentric lamellae. You can see how spaces which would have at the osteocytes. Now, one important point which you can notice here is that one osteocyte communicates with another osteocyte by canaliculi, which can very clearly be appreciated here, which is not present in the other hard tissue investigations such as ground sections. Now, this is just a schematic trying to appreciate a few of the histological structures as well as one portion of bone, which I will try to explain here. This is an alveolar socket comprising of the tooth. Now, the tooth is embedded within the alveolar socket by something known as the periodontal ligament fibers. Now, if you see, the periodontal ligament fibers are attached to the bone as well as the tooth. Now, the portion of the alveolar fibers, or the bundles of the collagen fibers, wherein the fibers are attached to the bone, it's called as Sharpie's fibers. So I repeat, this is an alveolar socket. The tooth is embedded within the socket. The tooth is attached firmly to the alveolar bone by something known as periodontal ligament fibers. And those bundle of fibers which are attached to that of the alveolar bone are called as the Sharpie's fibers. This is a schematic representation. This is how it appears under a microscope. So as I mentioned before, this is the periodontal ligament fibers. They are attached into the bone. And that portion of the fibers which are attached into the bone is called as the Sharpie's fibers. And that bone which carries these Sharpie's fibers are called as the bundle bone. Now, there are a few cells which you must know in alveolar bone. That is the osteoblasts, osteocytes, and osteoclasts. So in this picture, you can see that this is a decalcified section of bone. This is the bone present here. You can see the osteocytes and osteoblasts. There are basically two types of osteoblasts. One is the active and the inactive. The inactive are usually thinner cells, while the active are large round cells, which are seen closely approximated to that of the bone. They are the ones that are responsible for secretion of bone or bone formation. So they are derived from the osteoprogenitor cells. They secrete the osteoid, which is the unmineralized bone. And for mineralization, there is osteocalcin, alkaline phosphatase, which are enzymes which are secreted from the matrix vesicles, which increase the concentration of the calcium phosphorus, thereby mineralizing bone. Next, we have the osteocytes. So what happens is that after the deposition of bone, these osteoblasts get embedded or entrapped within the heart tissues, and thereby they become osteocytes. However, one osteocyte will communicate with another osteocyte by something known as a canaliculi through the process of cytoplasmic extensions. Next, we have the osteoclasts. So there are cells which resorb the bone, and there are cells which form the bone. The ones which form the bone are called as osteoclasts, and the cells which resorb the bone are called as osteoclasts. Osteoclasts are located in shallow depressions, which have been called as house shaped lacunae, which you can appreciate here. Now, the unique thing about these cells is that these cells are large cells, very large cells, and they are formed by the fusion of monocytes. They are not from osteoprogenitor cells. They are formed by the fusion of monocytes, which are blood cells, and they contain numerous nuclei, therefore called as multinucleated cells. So how did they go about resorbing the bone? They have a ruffled border, which function to secrete enzymes, thereby increasing the acidic content pH in that area, which is in the house shaped lacunae. Thereby, these enzymes are responsible for the breakdown of the bone. So three cells, which you must primarily remember: osteoblasts, which form the bone. They're derived from osteoprogenitor cells. Osteocytes are again osteoblasts, which get embedded within the bone, or osteoblasts which get embedded within the bone. They communicate to another osteocyte or something known as a canaliculi, and we have bone resorbing cells called as osteoclasts, which are seen in the house shaped lacunae. They are not formed from the osteoprogenitor cells, however, are formed by the fusion of monocytes. Now, radiographically, what you can see is here that the term which we use for the alveolar bone in an IOPA, as you can see here, they are radio-opacic line, which is seen around the tooth or the root of a tooth in a radiograph. Now, this is an IOPA, therefore you can appreciate this radio-opaque line. This is called as the lamina dura. As you can see, this is a very clear picture of how lamina dura appears. If you are not able to follow, it is the alveolar bone, as you can see in the schematic picture here, that it is around the root of a tooth. Now moving on to the applied aspects of the alveolar bone. To simply say, the alveolar bone is the bone which has the root of the tooth embedded in it, therefore called as the alveolar bone. As you can see in this picture here, imagine this is the height of the alveolar bone, where all the teeth are present and the roots therefore are present. Therefore, the function of the alveolar bone is to hold the root of the tooth. In the following picture, you can see this is an edentulous jaw. There is no teeth. There are no teeth. Thereby, the bone which is needed to support the root is not required because there are no teeth. So therefore, what we can see is that the function of the alveolar bone is to hold the root or the tooth in the jaw. And once the tooth is not present, that is, if in case of an edentulous jaw, what we can see is that the alveolar bone resorbs. Now, to see this clinically, this is a picture wherein you can see that the tooth is present on the left-hand side. The ridge is wide enough, broad enough, and you can appreciate the broad width. Here you can see that on the right-hand side that the tooth is being extracted for whatever reason it may be. The alveolar bone has resorbed. You can see the width has reduced. The height, as you can see in the previous slide, as I mentioned, has also reduced. So it becomes this is called as a residual alveolar ridge, and it is sharp. And this is the place where the dentures have to be placed. So to summarize, the alveolar bone is a very important part of the jaws, which comprises of, as you can see in this picture, is where the tooth forms, and eventually the roots of the teeth are embedded. Therefore, comprises important structures of the periodontal ligament, the cementum, the Sharpie's fibers, the osteoblasts, osteoclasts. So these are the important terms and points which you must know, and these are most important frequently asked questions in your theory exam. Hope this class was easy for you to understand, and I hope I have explained all the points which is required for your exam point of view as well. Thank you.